I'm Joyce O'Shaughnessy, the Celebrating Women's Chair in Breast Cancer Research at Baylor University Medical Center, Texas Oncology, and US Oncology in Dallas, Texas. The issue of whether hormonal forms of contraception raise breast cancer risk has been a very important question since hormonal contraception was widely introduced in the 1960s. And fortunately, there have been a lot more data that have been accumulated over the years to address this question. There were older series that were published in the New England Journal of Medicine, approximately 10 years ago or so, that showed that the original forms of contraception, hormonal contraception that were used in the 1970s and even early 80s were associated with an increased risk of breast cancer. But the issue there had been that the original hormonal contraception, the original hormonal contraceptives had higher doses of estrogen and progestational agents in them, and so leading to a higher risk of breast cancer. So more recently, there has been a study that I think is really the seminal paper in this regard. It was published by the Danish investigators in the New England Journal of Medicine in December 2017. The Danish had the ability to look in their nationwide databases, health databases, to understand when women were taking any form of hormonal contraception, as well as look at the national registries of breast cancer and to be able to understand which of these women later developed breast cancer. Very, very powerful resource. And they looked over a period of about 10 years at 1.8 million women in Denmark. And there were tens of thousands of breast cancers that occurred in this 10-year period. It's a very well done study. And the some of the findings from this very important paper are that hormonal contraception is associated with a very small increased risk of developing breast cancer. And now, fortunately, for women who just take, up to 5 years or less of hormonal contraception, once they stop, about 5 years later, all of the risk has disappeared. So a short duration of hormonal contraception appears to be quite safe. The risk of an increased risk of breast cancer is very, very small. And then that risk dissipates fairly rapidly, right down to the population risk within about 5 years or so. Some of the other issues that can raise the risk further are, importantly, longer duration of hormonal contraception. The Danish study only followed patients up for about 10 years or so. Some patients were on the hormonal contraception for 10 years and longer, but that was the duration of the study. And the longer a woman is on hormonal contraception, the greater her risk of breast cancer. Another factor that can increase the risk of breast cancer in women who are taking hormonal contraception is the use of progestational agents, either by themselves or in combination with estrogen, particularly the levonorgestrel, which is the progestational agent that is in the hormonal IUDs. You can also take this form of the progestational agent orally in combination with estrogen. The progestational agents, what they do is they increase the population of breast cancer stem cells. And so that can be a bit of a longer impact on breast cancer risk, particularly if the progestational agents are taken for longer than 5 years. Utilizing progestational agents alone, either as depots or as part of IUDs, do increase the risk, and perhaps a bit more than utilizing lower doses with estrogen and progesterone together. Another factor that can increase the risk of breast cancer from hormonal contraception is younger age at starting hormonal contraception, when the breast is still in development, for example. So these are some factors, and it's important to emphasize that the absolute risk, if you look at the additional number of women per 100,000 women, for example, that develop breast cancer because of hormonal contraceptive use in this Danish trial is exceedingly small. It's very small. I think the concern is for women that are on hormonal contraceptives for much longer than 10 years. I think in our society currently, many women will begin hormonal contraceptive young because of dysmenorrhea, for example, acne, for example, and will continue on it continuously until they are until the time of childbearing. And then oftentimes women will get back on hormonal contraceptives between having children and also after having children. And so I think that's the unknown, is that some of our approaches now to hormonal contraception can span many decades, and it is unknown. It is clear that the risk goes up the longer a woman is on it. And I think the recommendation generally is, if a woman gets to be age 40, for example, she's pretty well finished up childbearing, for most patients, is to consider a non-hormonal form of contraception, such as an IUD that does not have hormones, a copper IUD, or a barrier contraception. I think this is just a very good approach in general, which is to utilize hormonal contraceptives, as sparingly as possible, and to consider non-hormonal means when it is a possibility for women.